The role of women in medicine has been evolving over the last 170 years, with the graduation of the first female physician from medical school in 1849, the first female surgeon in 1855, and the first female African American physician in 1864. However, it wasn't until 1954 that the first African American female became a surgeon. And within neurosurgery, the presence of women was further delayed, with the first female neurosurgeon entering the scene in 1928 and remaining the only female neurosurgeon for 32 years. Moreover, it wasn't until 1981 that Dr. Alexa Canady broke down further boundaries for future women physicians by becoming the first female African American neurosurgeon. Although recent years have seen significant advances in gender equality in medicine, neurosurgery as a specialty remains incredibly competitive, but also strongly male-dominant. Currently, women account for only 5% of practicing neurosurgeons certified by the American Board of Neurological Surgery, less than any other surgical specialty. Furthermore, Black women make up less than 1%, testifying to the lonely and trailblazing pathway forged by those before them, including Dr. Canady. Where did it all begin? Dr. Alexa Irene Canady was born on November 7, 1950, in Lansing, Michigan, as the only girl of 4 children, into a family that valued hard work and education. Her parents promoted education as being intrinsic to the family and were incredible role models, including her mother, who worked in education and, among many accomplishments, was voted the first African American on the Lansing School Board.
And the question was not, do you want to go to school? Do you want to go to college? It was always starting at about 2, what college do you want to go to? So there was a presumption of education. And when I was a girl, my mother used to say, you go to school, that's your job. I go to work, you go to school, and that's your job. And so it was just understood that education was the key.
And although she found great success in her early studies, including being the youngest winner of the Youth Talent Science Fair at age 10, graduating high school with honors, and as an inductee into the National Honor Society, she entered into college a bit lost.
Well, I wanted for years to be a mathematician. And then in my second year, really end of my first year of college, figured out I didn't really like it like they liked it. And so I was lost. And I'm a person who needs direction. And I can do whatever you want, but I need to have a plan. So I was very much without a plan. So my brother, who was also at Michigan, had heard about a scholarship program for the summer where you went to the medical school, you worked in somebody's lab, you had some lectures, and I loved it. But that's how I found medicine. And once I found medicine, I was ready to be a student again.
Ultimately, Dr. Canady graduated from the University of Michigan in 1971 with a Bachelor of Science degree in zoology. Her attendance coincided with a period of racially fueled frustration in 1970, when Black students, unsatisfied at the racism on campus, demanded increases in Black student enrollment and faculty hires, ultimately resulting in a seminal campus-wide strike. During that time, Dr. Canady was also inducted as a member of Delta Sigma Theta, an organization that her mother once was the national president of, and is dedicated to confronting the issues impacting the Black community. She went on to attend the University of Michigan Medical School, from which she graduated cum laude in 1975, and was additionally inducted into AOA. Initially, she wanted to be an internist, but in her second year had a change of heart.
I liked medical school a lot, and everybody else was kind of tired from working in college, and I hadn't worked very hard. So I was really enjoying being a student, and I studied all the time because I enjoyed it. And the thing I most enjoyed was we had an interdisciplinary course called Neurobehavioral Sciences. And it was well taught and well thought out, and I loved it. And so then the question was, what kind of neuroscience? And I just liked neurosurgery better. But in the end, I thought neurosurgery was more honest. I was right or wrong. You make a decision, you believe it's true, and you're right or wrong.
But earning a training spot in neurosurgery wasn't going to be easy, and Dr. Canady knew that.
I had expectations of difficulty, but I'd faced that all my life. So, I mean, I think being a black woman was a major advantage because I didn't really expect people to like me, and I didn't really care whether they liked me. So I wasn't seeking approval, I wasn't seeking anything other than certification.
Some forms of challenge were expected. She was discouraged from pursuing neurosurgery from some of her advisors and peers. Early on, she had trouble securing an internship. Despite her accolades and the support of other faculty, she could not win over the chair at Michigan. And to prove so, he made her come back to interview a second time on Christmas Eve to send a message. But other areas where she lacked support surprised her.
You know, my parents, for the first time in my life, were not as supportive. They weren't opposing it, but worried that I was reaching for something that was unobtainable. And that surprised me because I'd done some weird things along the way, and they always said, go for it. And this time they didn't say go for it. They didn't say don't go for it. It didn't make me question it at all. I had at that point decided that this is what I was going to do. Now that doesn't stop those moments when you're sitting in the movie and all of a sudden you say, if I don't get in, what am I going to do?
Despite these early challenges, she was eventually offered a surgical internship at the prestigious Yale New Haven Hospital, which she completed in 1976. Her trials, however, were far from over, as despite a successful internship, Yale refused to confirm that she had secured the residency training spot to follow internship.
I think I might be in the running for your position, but he doesn't announce it until October 1st. Would you tell me early? And he said, if you want it, you'll wait. So I took the position in Minnesota. And I always use that as an example of different lenses. So I'm a woman trying to get a position in something that no one has. And he has a really good residency, no doubt about it. And so he thinks I should wait for his residency. But I'm going to take, Minnesota's not a chump place. I mean, it's a really well-respected program. And I'm going to take that job because I'm not going to wait and hope maybe I'm your girl and then I end up with nothing.
Although later Yale admitted the position would have been hers, by taking the job in Minnesota, she became the first female African-American neurosurgery resident in the United States. She described the training experience as excellent, but not without its own set of prejudices, which started nearly immediately when the chairman had an interesting way of welcoming her.
And so the first day I'm on the floor, he walks up to me and said, you must be our new equal opportunity package. So I looked at him and I said, well, yes, I guess I am. And he never bothered me after that.
This strength in standing up for herself largely developed as a result of her family's mindset. Dr. Canady tells that her mother once told her, who cares if you are the token Black person? Take that token and spend it. And dinner time talk every day revolved around how to advocate for themselves.
Well, the social training of women is to kind of retreat. And, they're certainly talked over. I wasn't so much a victim of that. But I'd been trained differently in my family. I think it makes a huge difference. Yeah, it makes a huge difference. In my family, the family dinner table was a debate forum. We discussed issues, and at the house you could say almost anything, So we discussed issues, and you'd get torn apart or built up or agree or disagree. So you learn that there's an agenda and there's a story and there's a truth.
And Dr. Canady did catch that token, and with the help of supportive mentors, flourished during her training. She credits much of this to Shelley Shue.
He was just an exquisite individual. His way his mind worked was phenomenal. And when you discussed a case with him, you learned a lot in terms of process. So I loved that part.
But that success came with its own set of challenges, including being lonely.
It, in some ways, was liberating because they didn't quite know all their rules applied to me or not. But in other ways, it's just lonely, and there weren't many women in Minnesota at all on the surgical side. No women faculty on the surgical service at that time. And so there wasn't a community of support.
She went on to complete her pediatric neurosurgery fellowship in 1982 at the Children's Hospital of Philadelphia, where her fellow physicians voted her one of the top residents, and became the first board-certified African-American neurosurgeon in 1984. Initially, she worked at Henry Ford before moving to the Children's Hospital of Michigan. After only 4 years, she was promoted to the chief of neurosurgery at the young age of 36, and remained so from 1987 until her retirement in June 2001. She retired after 18 years, having trained all 4 of the remaining neurosurgeons. She also conducted research and taught as a professor of neurosurgery at Wayne State University. She retired in 2001 and moved to Florida. When she learned that there were no pediatric neurosurgeons in her immediate area, she began to practice part-time at Pensacola Sacred Heart Hospital and achieved full retirement in 2012. Despite this illustrious career, the challenge of systemic intolerance never disappeared.
It's always very subtle. That is, they like you too much the next day after you've done something for them. And so you know that what they thought was pretty bad if they are so overly solicitous now. So I think I've learned, I guess, in my approach to life is to be fairly oblivious to it all. It is their problem, not my problem. So I'm just gonna do my job.
When asked about the importance of diversity in medicine, Dr. Canady has an insider perspective.
So that if you have a child, and you have a lot of them now, who are born in an upper middle class gated community, go to a private school, go to a selective college, they don't see the rest of the world as people. And if they don't see them as people, they can't care for them properly. You know, study after study after study has shown that a black patient that comes in with exactly the same symptoms is undertreated repetitively, and this causes lives. So there are just many, many cases of undertreatment. You don't see these people who were never part of your life, with whom you do not have an emotional connection, as real people who deserve time.
In addition to her clinical and administrative responsibilities, Dr. Canady conducted research and taught as a professor of neurosurgery at Wayne State University. In true form of her humble, patient-centered nature, Dr. Canady stated that she would like her legacy to be remembered in 2 ways. First, she taught people that disabled kids are still kids.
And my experience with disabled children is they bring me something. They have a different way of looking at things, and I learn things from them, just like you learn from anybody else. And you have to be open to that learning process. And I think it's important to teach other people to be open to them and to treat them with respect.
And second, she wants to be remembered for how much time she put into running a service and organizing and making a point to have active partners, and to engage the patients as well as their parents. She cited one of her biggest successes was reconnecting with a previous patient from Henry Ford, and him as an adult stating, "I always knew you were my doctor, not my parents' doctor."
I think that if I'm a neurosurgeon and I'm a pediatric neurosurgeon, I'm the kid's doctor, and I'm not his parents' doctor. And he needs to understand that. And I didn't think they got it like that. I mean, he wasn't even prompted. That was what he said at my retirement party. And I just smiled because I made real efforts to do that.
Her advice to the future of medicine is simple. First, stay true to yourself. Second, people spend too much time trying to be famous. Your heart should be about doing the work. And if in doing the work you become famous, okay. And if not, then you know you at least committed and did the work. Now in retirement, Dr. Canady resides in Pensacola, Florida with her husband, George, whom she met at a neurosurgery convention and whose unwavering support she credits much of her success to. In her free time, she is involved in many community service acts, but most often can be found playing competitive bridge. And although her success requires no retribution, She did at least circle back with her parents about their initial lack of support.
I teased him about it. Yeah, I teased him about it. It's the only time you kind of didn't go full bore with me, Well, I think by definition I'm a trailblazer, but it wasn't my intent to be so, and it was a byproduct rather than a goal.
Although a byproduct to Dr. Canady, her steadfast determination to pursue a goal attained by no other sets the stage for future women of diverse backgrounds to consider pursuing their personal interests in medicine, with the vision of pushing the needle of equity well past the current 1% within neurosurgery. And for all of these reasons, today we celebrate Dr. Alexa Canady.